Good morning, everyone. Hazel Cheeseman here from ASH. Thank you for joining us this morning. It's great to have so many people on the line for this webinar at what is clearly a difficult time for all of us in different ways, and we're all facing, personal, professional, and organisational challenges. And the webinar this morning, I think, is really about, in this challenging time, how can we find the opportunities as a movement to address the challenges that we always face in supporting smokers to quit, but also the specific challenge of right now of smokers facing some additional risks from COVID, which we'll talk about through the webinar. And I think there are real risks at the moment that if we are not proactive as a community and get out there and communicate with smokers, that we could leave lockdown with smokers smoking more, ex-smokers having relapsed, and suffering all the ill health consequences that would lead to. But conversely, if we can seize this moment, then there is an opportunity to help more people to quit and ease the burden on the NHS at a time that is so important. So today's excellent lineup of speakers is going to help us think about where those opportunities are and how we can seize the day. We have lots of information that we'll be sending you after this webinar. The communications toolkit, which Andy and Scott are going to talk about today. Hopefully you've already seen it, but we'll be sending that out to you again. We have already circulated, as have Public Health England, a document around practice examples, and hopefully you've also received an invite this morning to a follow-up webinar next Thursday to this webinar, because there are so many great examples out there of local areas who are really seizing the moment, and we wanted to run another session so that you could hear from more of those case studies, although we're going to hear from Sheffield today about the work that they're doing to support smokers at this time. And I should also advise to let you know that the NCSCT are producing some guidance around how we can do remote consultations at this time based on the best evidence, and that will be coming out shortly. I don't have a precise date for that, but we'll certainly circulate that as soon as it's ready and it comes out. We ran a webinar on smoking in pregnancy and COVID earlier this week, which is available online if you weren't able to attend. It was really interesting. And we're also looking to run one on mental health shortly too. So there's lots of information that we're developing. So keep your eye on the Smoke Free Action Coalition website and on the emails that are coming out. So today's webinar, shortly we'll be moving to hear from Deborah, Chief Executive of ASH. And then we'll move on to hear from Dr. Nick Hopkinson on the clinical risks and evidence around smoking and COVID. And then, as I've mentioned, we've got a review of the Quit for COVID campaign and the resources that are being developed there from Scott and Andy. And then we'll hear about the exciting work that's happening in Sheffield before we move on to questions. Speaking of questions, if you would like to ask one, if you look at the right-hand side of your screen, there is a tab which says questions. Type your questions in there. Please put in as many as you like. We may not get to all of them, but we will follow up afterwards on any questions that we are not able to answer during the Q&A session at the end. So please populate that with lots of questions for us to put to the panel. I think I've already covered the overview. So we'll move on now, and Deborah is going to give us a set of slides on local authority action, and Robbie is now going to get Deborah to take control of the slides. So I'll hand over to Deborah.
Thank you, Hazel. And let me just see if I can get, how do I get it up? Full size, show my screen. I'm Robbie. How do I go to full screen? Sorry, I'm having problems with this.
That's okay. It's the two icons over. Just the next one over on the right. Yeah, there you go.
Okay, is that the one I can, the best one. Can people see the screen properly? Because I've got something on the right-hand side covering it up. Sorry, I'm not very competent at all of this.
That's right. We can see your screen, Deborah.
You don't see the box that I've got on audience view and everything?
No, only you can see that.
Okay, right. Yes, so sorry about that. Yes, I'm just going to follow on really from what Hazel's been saying to talk about why local authority action on smoking can deliver for councils, both for COVID-19 and beyond. And it's supported by the LGA. Councillor Ian Hudspeth gave us a great quote on the launch earlier this week. Public Health England, the Association of Directors of Public Health, the Chief Medical Officer, and so on and so forth. And I just want to talk about the case for action for local authorities now and in the future. And Nick will go into this in much more detail. Smokers who contract COVID-19 are at higher risk of severe complications, thereby putting extra pressure on local authority services as well as the NHS. Smoking, as you all know, is the leading cause of inequalities in mortality and morbidity, and responsible for half the difference in life expectancy between rich and poor. But this isn't just an issue for individuals, it's also for local authorities. It adds pressure to the social care budget, and it damages the local economy. Money going on tobacco is a net loss to communities. It costs, smokers are spending over 12.5 billion a year, and that money goes to the Treasury in tax and to the tobacco companies in profit, and a very small amount remains in the community in terms of profit to tobacco retailers. So retailers make typically 5 to 7% profit margins on tobacco. The tobacco industry makes up to 60% and more return on investment, so they're doing extremely well out of it. So the case for action for smokers is that they can improve their health and well-being by quitting. Smokers lose on average 10 years of life, as well as suffering many years more reduced quality of life. So every year there are nearly 80,000 deaths a year in England, and for every death there are 30 times as many people suffering serious smoking related diseases, which affect their ability to work and their earnings as well. So it's never too late to quit. Smokers, for example, quitting on diagnosis with lung cancer can nearly double their life expectancy. It's also a contributor to poverty. So nearly 500,000 households in the UK live in poverty because of the cost of smoking, and that's over 1 million people, including around over 250,000 children. So there are good reasons for doing this, for COVID, but also for the longer term. And as we come out of lockdown and we come out of COVID, the economic impact as well as the health impact of smoking will be incredibly important when we know that there are even more people unemployed and under more pressure. And the opportunity is there. We've been working with YouGov, who do a weekly tracker on the response to COVID, and over a quarter of smokers say they're more likely to quit, and over a third have cut down cigarette consumption. 2% of ex-smokers have quit completely, and that's around 300,000 additional ex-smokers because of COVID-19. So the opportunity is there, but not all are succeeding, and more have failed than succeeded. So nearly 1 in 10 smokers in England have tried to quit for COVID but failed. That's over 500,000 smokers. And it's hard to quit. On average, smokers have to try over 30 times before they succeed. And smokers using stop smoking services can triple their likelihood of success. And that's obviously where local authorities come in. And Ash has done a very quick, we do an annual survey of what local government tobacco control measures. We updated it very quickly following on from the COVID pandemic, because we knew that it was having a massive impact on local authorities, and in particular on what stop smoking services can do. So the vast majority of local authorities are providing smoking support from trained advisors, and the vast majority are still providing pharmacotherapies such as NRT or varenicline, or supporting smokers to use e-cigarettes during the lockdown. But most services are not seeing more smokers. Even though we're seeing a motivation to quit amongst smokers, we're not seeing that transferring over to the services. So about 1 in 5 are seeing an increase, but more than half are not, and 1 in 5 don't know. Now, what we do know, and others will be talking later in more detail about how this can be done, is that local authority action can drive more smokers to effective support. And the areas that have seen an increase in demand for their stop smoking support are generally those doing proactive outreach. You're going to hear about Sheffield later on, but Hertfordshire, for example, the county council contacted the local CCG in late March and asked that all local GP practices to text all smokers and ex-smokers in their records, advertising local support. And this prompted approximately 600 referrals into the service in the last 2 to 3 weeks. And clinical support hours have increased from 70 hours a week to 184 in response to the demand. And that's the end of my talk. So I'll hand over now to whoever's coming next.
Thank you, Deborah. A couple of questions have come into the bar on the question bar, which I can answer quickly. So the information on the webinar I mentioned at the beginning will be circulated with the slides from this webinar. We'll also be circulating an evaluation form at the end, which we'd really like you to fill in, because we're also going to ask you for some feedback on what more support you would like from us, particularly in relation to communications, which we'll come on to later. So we're now going to move on to a presentation from Dr. Nick Hopkinson. Nick is the Reader in Respiratory Medicine at Imperial College London and an honorary chest physician at the Royal Brompton. He's also chair of ASH, and Nick is going to give us the kind of clinical background to the issues around smoking and COVID. So Nick, we are handing over to you and sharing your screen. You're all up and ready to go. So I'll hand over to you, Nick.
Great, thank you. So I'd just like to take a few minutes to go through what we sort of thought about COVID-19 and smoking, and what we can confidently say about it now. So what we know of underpinning smoking hasn't changed. So it's a huge public health problem. Kills about 100,000 people a year in the UK, and current smoking is responsible for more than 400,000 hospital admissions a year. We're not all in it together. Smoking affects the poorest and most vulnerable groups, and particularly people whose care is the kind of particular concern of local authorities, and it is likely to be one of the reasons why there is a big impact of deprivation on COVID mortality, because smoking is certainly a very strong driver of health inequality. So in terms of smoking and COVID-19, I mean, I think there are sort of two issues, and I'm not going to touch on the first two very much. That smoking just by itself puts a major burden on the health and social care system at a time when a huge amount of resource and attention has been moved into dealing directly with COVID. So in terms of how well the system can cope with that, we need to take all the steps we can to reduce demand on the health system, which is preventable, both from conditions that are completely unrelated to COVID, heart attacks, strokes, exacerbations of chronic obstructive pulmonary disease, but also the direct impact on COVID-19, which I'll be talking about specifically. The other issue, which is worth just mentioning, is that smoking is an occupational health issue. Smokers are more likely to take time off work, and one of the things that the health and social care system needs at the moment is that everyone that's to be as healthy as possible to deal with this kind of unprecedented demand. So we need the population to be as healthy as possible, and particularly we need people that are working incredibly hard in health and social care to stay as well as possible. So COVID-19, the question is, does smoking increase your risk of getting the disease? Does it make it more severe, and particularly is it associated with risk of death from COVID-19, which are clearly questions that are important to the system and to individual smokers. So what do we know about infections in general? There's a lot of data in the Royal College of Physicians report that was published a couple of years ago now, looking at this. With some key facts from that. Smokers are 5 times as likely to get flu, twice as likely to get pneumonia, and as mentioned again, current smoking. So this isn't the consequence of diseases caused by past smoking. So in current smokers, about more than 400,000 acute hospital admissions are related to smoking. So early on, one of the very striking things was the massively increased risk of death in smokers from another coronavirus infection, the Middle East respiratory symptoms. So in a population of 19 people admitted, all 10 of the deaths occurred in smokers. So this is this is clearly a factor in that coronavirus that's associated with increased risk of death. The understanding what the SARS-CoV-2, the COVID-19 virus, actually does is a very rapidly evolving process. So the virus binds to ACE2, which is a molecule that is very involved in regulating vascular function. And it as well as directly infecting cells in the lung, it spreads to can spread to other organs in the body, causing very widespread damage to blood vessels. So you're getting inflammation and blood clotting occurring in blood vessels in the heart, in the kidneys, in the guts. So you're getting a very wide range of symptoms. And the condition is clearly enormously variable. So there are factors within individuals that influence whether they're infected and are completely asymptomatic, or they have a very mild illness with coughs and fatigue, or whether they develop more symptoms, a more severe disease, and this cascades into a life-threatening condition that requires hospitalization, treatment with oxygen, going on to ventilator, renal support, and then likely a long stay in hospital, and then a very long period of requiring support to recover. So the best evidence now is that smoking increases the expression of this receptor in the lung. So there's a theoretical reason why smokers will be more at risk of infection. So the data so far from from case series has been a little bit confusing, because even though there's been and this is reviewed in a sort of live evidence review that the team at University College London are leading, in published papers so far, there appears to be evidence that smokers do worse if they're admitted to hospital. They're more likely to have severe disease, they're more likely to need oxygen or to go to intensive care, and more likely to die. But the actual prevalence of smoking recorded seems to be rather low. Now, it's not clear whether that's to do with poor reporting. Smoking status is often not recorded. Some of these people are too ill to ask. And certainly in our health system and others, recording smoking status historically has been problematic. The other thing in terms of some of these comparisons is that the rate of smoking has been related to the adult background rate, and of course, and smoking rates fall as people get older, because they have longer to choose to give up, and also because, of course, the reason we're having this discussion is that smoking kills people. So you're less likely to get to be old enough to be particularly vulnerable to coronavirus if you've been a smoker, because heart disease or vascular disease or lung disease or cancer may have carried you off already. So what we seem to be facing with these hospitalized series is a degree of insufficiency in the way the data are recorded, and they're not telling us that much about the population. So I think one of the most compelling pieces of data so far has come from the Zoe COVID symptom tracker app, which when these data were reported had 1.5 million people contributing to it, and I think nearly 3 million people are now have now registered with and used the app. So that showed that in people who registered that and then recorded symptoms, that the chance of getting a set of symptoms during the pandemic, so in this case fever and persistent cough, was about 26% higher in people who reported they were current smokers. Now, analysis of this is ongoing and hopefully will be published in the next few days. But what I can say is that the symptom tracking data continues to confirm this, that depending on or regardless of how the having COVID is defined, current smoking does appear to be a risk factor for that to be higher. The other big data set I think that's important to look at is people admitted to the UK. So this is a prospective collection of data set up to anticipate pandemics, which looks at people admitted to hospital. So a couple of things you can see, that this breaks down the outcome on the right in women, on the left in men. And you can see whether people have died. The darker blue, the pale color are discharged, and the intermediate shade were people who, at the point that this analysis was done, were still having care in hospital. And you can see that this is, clearly a disease that affects older people. So there are very few people admitted up until about the age of very, very few people admitted below sort of 40, I suppose. And then you're getting increasing rates of death in older people, and particularly in older men. So the other data that this has collected is the comorbidities that are present in individuals admitted to hospital. So the cardiac disease, diabetes, and lung diseases are common. So all conditions that are associated with smoking. Now, the actual smoking rate, they haven't provided a figure for that, but it is about 6 or 7%, which seems like a low number. But for over 65s in 2018, the smoking rate was only 7.9%. So allowing for data collection, it suggests that the number is about what you would expect in this sort of population. And of course, it's important to recall that a lot of people who are being admitted with diagnoses of long-term conditions that are caused by smoking will have quit smoking because they have that condition.
Nick, I have to ask you to speed through the last
crack on. And so the final thing again is just, I think, the best data so far in terms of risk. This is a properly published study in New England Journal of Medicine. So quite a lot of the data so far has been from preprints, but this shows in people admitted to hospital in across Asia, Europe, and North America, that the risk of death for current smokers is 1.79. So nearly 80% more likely to die if you're admitted to hospital and are a current smoker. And again, that risk of death is also associated with other long-term medical conditions. And those data are matched by the symptom tracker data. And again, that's showing the numbers on the right, that the risk of being admitted to hospital if you are self-reported with COVID, or if you've been tested with and found to be coronavirus positive, are increased in smokers. So I think we can say confidently that prior probability that smoking would have a bad interaction with COVID-19 was very high. There's a mechanism that smoking upregulates the receptors. We've got very good data that there are worse hospital outcomes, and we've got population tracker data that is suggesting that smokers are at greater risk both of getting symptoms and of being hospitalized. So thank you.
Fantastic. Thanks, Nick. That was a really interesting take through the rapidly changing evidence. I'm sure people will have questions from that, and I would encourage you to add your questions to the bar on the side, and we will get Nick to answer them at the end. It's a great opportunity to ask him some questions. So we're going to move rapidly onwards, and I'm going to hand over to Andy, Lloyd and Scott Crosby. So Andy is from Fresh. I feel like neither of you will need any introduction. And Scott from Breathe 2025, to talk through the Quit for COVID communications work that we've been doing, and particularly the communications toolkit, which was distributed on Friday, and we'll certainly reattach that when we send out the slides from this event. So I can see that someone's screen has been shared, and we're waiting for the slides to appear. Nick, we can still see Nick's screen, I think. Right, let's get Andy's.
Is everybody up?
There we go. Over to you then, Andy.
Okay, fantastic. So Scott and I are going to do a bit of a double act here, but I think the first thing to say is for us in comms, I think Quit for COVID has been something of a right to know issue. We're all supporting, hugely important messages around preventing the spread of COVID, but, also with regard that there have been calls by doctors, by the World Health Organization to keep ourselves fit and resilient right now. And I think from the perspective of the smoker, if emerging evidence is that smoking puts people at more risk if they do get COVID, as Nick's just outlined, it's information I think we'd all want to know about. And we know already from insight, most smokers underestimate the 1 in 2 risk of dying from smoking. Most are at least aware that smoking is bad for the health, and they'll associate it with diseases like cancers and heart disease and stroke, whereas we're all getting our heads around COVID. It's new information for us all. So initially, from the kind of what do we know so far? Well, there does seem to be some receptiveness out there to quitting messages, but we're also very conscious of the barriers when we started out with this. We know everybody's stressed right now, and we know that when people are anxious, some people who smoke, those with mental health problems, for instance, are more inclined to smoke more, especially with regards to the economic uncertainty. And there's also another barrier which exists all the time, but potentially arguably right now, which is a fatalism, especially among older smokers, that it's somehow too late to quit, which we need to counter. So moving on, I think the first thing to say, this was in the toolkit, that Quit for COVID was a movement that started out, I guess, not as a campaign in the traditional sense, but kind of driven organically. It was driven by clinicians and public health organizations, and the aim really for us is to support this, but also drive it forward with the support of all of our local partners with messages that really resonate with people. So the term was coined by the NHS. It was from Dr. Charlie Kenwood, a GP from Bristol, who raised it during an intervention, encouraging a mum to quit with her 9-year-old son in the room at the same time. Since then, we've seen statements from the Chief Medical Officer, from Matt Hancock, from a number of organisations around the country, Fresh, who I work for, Ash Wales, Centre for Perioperative Care, Smoke Free Sheffield, and especially Action on Smoking and Health. And I think we agreed we needed a coordinated campaign, one very much which delivers the messages with facts, with integrity, something that doesn't scaremonger, but really importantly signpost ways to quit and to get over that barrier that it's too late to quit smoking. So a national strategy group exists, and a comms group sits under that to help lead the agenda and coordinate messaging and enable partners to do so. So we've got membership from Smoke Free Action Coalition affiliated organisations, so Ash, Fresh, Breathe 2025, Greater Manchester, and the key charities, Cancer Research, British Heart Foundation and British Lung Foundation, with Public Health England in an observational capacity as well. So just moving forward, one of the first tasks of that was to develop a PR and comms toolkit to really give partners kind of those evidence-based messages to communicate with clarity. It launched last week. Hopefully everybody's seen it. I think it was a huge job to get it out. It was a real team effort from the Smoke Free Action Coalition to do so. So it's got a background to Quit for COVID, which I've just outlined. It's got facts, stats, key messages, not just around COVID, but also for general health and the benefits of quitting as well, because we're very conscious of those messages around, the existing harms that we know about smoking are really important right now at a time when many people are, would be careful to avoid or wanting to go to hospital. It's got ideas for local communications actions that tailored also to stop smoking services who are having their own challenges at the moment as well, working in a more remote way. Template articles, social posts and graphics. It's got links to a very detailed question and answer document, which is on the ASH website, which is being updated. And then also some of the wider comms considerations as well. So the first kind of job from that, really, we needed a formal launch for the campaign, really, I guess, for partners to see a sense of something happening. But we also used YouGov figures, which I won't steal Hazel's thunder on this, but really showed what we were hearing anecdotally from Stop Smoking Services, that there is an increased motivation to quit out there. So a really strong hook in capturing that, but also kind of normalizing quitting. I think there's some great headlines that resulted from this PR, but I think one of my favourites was from the Yorkshire Post, this surge in motivation, which captures it really nicely. We also, as Deborah outlined, on the day, we saw huge support from the Association of Directors of Public Health, with Ruth Tennant quoted, the Local Government Association, also calls from Public Health England to support smokers to quit right now. This is a case study, Philip Kyle from the Northeast, who Philip is immunosuppressed and counted himself higher risk. And despite quitting previously, he's been fronting a lot of the national and the regional media around, really determined to make it a success this time, which anecdotally is what we're hearing from Newcastle Stop Smoking Service, where Phil originated from. A useful tip that I think we've come across is we all know, in normal times, finding case studies isn't the easiest thing in the world, but thanks to Smoke Free Sheffield, who seems to have cracked it by getting the Stop Smoking Service to text recent quitters to see, would you like to be a case study? And I think we've had some real success getting people through the system. So I think that would be a really, really good tip to share. Certainly, I can't think of a story that's had more coverage in terms of blanket coverage nationally. This is just some of the national coverage that we saw pick up for. It was also picked up by Press Association, which meant it really kind of worked its way through kind of some of the regional publications, both in print versions online. And I think we're only just seeing now, kind of even today, kind of pieces of coverage coming in there. I mean, obviously getting the Daily Star was a particular scoop for us, I think. But also, some brilliant coverage being picked up by local government, with a great quote there from Councillor Ian Hudspeth, and from Ruth Tennant from the Directors of Public Health. So we as a kind of comms group are looking at kind of keeping this going, not just around COVID, but just some of the overarching themes we have. So here's some ideas. I think some of these we're going to be looking at: Mental Health Awareness Week coming up from May the 18th, menthol ban from May the 20th, potentially a huge behavioural opportunity to be communicating with smokers around the taste of their cigarettes, tasting the poisons for the first time potentially. World No Tobacco Day on May the 31st, which is always a kind of like ask questions of the tobacco industry, which is still hugely profiting from tobacco around the world. Looking at children's exposure to secondhand smoke during lockdown. We're also thinking about kind of some content pieces as well. Those kind of 5 things we've learned, articles that seem to be very popular on online news sites, and also really importantly, as we come out of lockdown, the economic impact of smoking, as Deborah's outlined, it's a massive cost and a massive drain on communities in the public sector. So I'm just going to hand over to Scott now.
Thanks, Andy. I'll just show my screen. So I'm just going to go through and highlight some of the resources available. The Quit for COVID campaign sits under and beside Today's the Day branding and messaging. And just as a bit of a backdrop, the branding, it was co-created by behaviour change experts, smokers and clinicians. So it was a bit of a come together, and it's basically there to inspire a positive behaviour without, I suppose, neglecting the kind of warts and all, the challenges of smokers that Deborah highlighted. It's difficult to challenge, and people in these times are finding it difficult. So we really need to bring those to life. The theme Today's the Day is based on it's based on insight around preparing and planning for that quit attempt, but also bringing it to the immediacy of that quit. We know that most smokers want to quit, but we need to bring that to the top of their to-do list, and that's the job for us to do. We've used the branding successfully over the last 2 years for No Smoking Day, and that's gone down. We've had a really positive engagement with local authorities and areas with No Smoking Day. And it's based on what we really want to do is sort of normalise that quitting. We want everybody's quitting and quitting together. So that's the kind of movement that we want to create. The creatives that we've got are fairly light touch. So these are these where we started from. These are real smokers, and we've really pulled that back to a lighter touch feel around this, and that's kind of done on purpose. It's done because certainly what I've seen is some fantastic innovation locally, and I think the best ideas come from you locally and from the ground, and I'd really love to see that. So what I'd really like to see you make this light touch campaign real to your areas, and bringing out all the characteristics of your areas and the smokers in your area. So the kind of things that we've really seen over the time, and I've just pulled some of these off Twitter and social media, but we've seen real people in the community. We've seen counsellors getting behind it, clinicians, healthcare professionals. So my challenge to everyone locally is to make this really a local campaign for you and make it human. That's what makes a campaign like this so powerful. So we've got a web page. So we've got the Today's the Day web page with fantastic evidence on there and help to quit. And it's really important that we shout out that our support is available in our areas. And we'll keep that website up to date. Also, we've got a Twitter clinic, which Louise and Maggie run from 7:30 till 8:30 every evening on Twitter, and so that's a really good opportunity for smokers to engage or just to go through hashtag quit for COVID, and you can really look through some of those Twitter feeds in there. And also, we're going to be launching a quit cast, so a podcast really around COVID and smoking and quitting going forward. So we've got lots of resources available on there. Please take a look. We've got campaign assets. We've got social media that's already written for you to really push out in your areas, and templates to personalize and tell people around you about your services and how to access those services. So for me, please engage your counsellors, GPs, healthcare professionals, academics in your local area. And to me, just to summarise, this is not a national campaign. This is a collaborative movement, but it needs to be your campaign. You really need to make that real. And the next steps, the page there, I just want you to think about in your local areas, how you get that onto strategically, how you tell people about your stop smoking offers, and how you really pull in your stakeholders and your partners in your local area.
Thanks, Scott. That was great. I thought you were going to call it Twitcast for a minute, but you seem to have avoided that.
I did get my tongues twisted with that, so I left it.
So we've got so much great content that we are running behind time. So we will, if the speakers are able to stay a little bit longer, I think we will run slightly over 12 o'clock to do the Q&A, because we want to make sure that we hear all the information from Sheffield and what they have been doing. So I'll hand over first of all to Greg Fell, the Director of Public Health in Sheffield, and then Sarah Hepworth is going to move on to talk about the detail of what they've been doing. So over to you, Greg.
Thank you. I'll be very brief and I'll let Sarah do most of the talking. I didn't know there was a tweetcast. I'm going to look out for that. So I'll talk briefly about ADPH and then about my take on this as a jobbing director of public health. So ADPH, of course, is pushing this one quite hard, and Ruth Tennant's quote sums it up quite neatly. It's in the press release of a couple of days ago. As an organisation, we continue to push Quit for COVID campaigns as they gain more and more traction nationwide. So more locally, who didn't know smoking was bad for you? I don't think anyone put their hand up there. COVID just provides more impetus, basically. We know that COVID is going to be around for a long time to come. We know that we're kind of getting towards the end of wave 1, but we know this is going to be around for a long time to come. So this won't be a flash in the pan thing, because our effort now will continue to yield long-term results. It will save lives, will protect the NHS, whatever phrase Boris comes out with next. Quitting smoking will be a part of that, and as Nick has already articulated, it is bad for individuals, it's bad for the NHS, it's bad for the economy. So what we do now will have a long-term impact. So Sarah will tell you in a minute, our stop smoking services are really quite busy at the moment, and long may that continue. We're simply exploiting an opportunity, and of course that's cynical of us, but why not? Because as I say, it will save lives. So we're exploiting the opportunity to drive population level quits, as well as directing smokers to local services. And I think, as Scott said, that's really important. Localizing some of this is really important, and normalizing smoking through giving people hope that they can do this. So we know we're not alone in this space. We know lots of places have picked up the Quit for COVID campaign and are doing some amazing work. But I'll hand over to Sarah, who's going to talk you through some of the black box of what we did in Sheffield, how we did it in Sheffield, and some of the things that we've learned from that. So I'll hand over to Sarah.
Brilliant, thanks, Greg. So I'll take you through our approach to tobacco control during COVID-19. And I think, first of all, oh, sorry, my slides won't move. First of all, one of the things that's been really important is having a comprehensive programme of tobacco control. That's enabled us to move really quickly on some of these areas, particularly around marketing and comms. So in terms of lessons learned, I just wanted to flag that at the start. So following the Government and Public Health England advice on March 17th around social distancing and to reduce the transmission of coronavirus, Sheffield, like many other areas, stopped all face-to-face contact and carbon monoxide monitoring of stop smoking services, and we moved our adult service to telephone, online support, video conferencing, and we also moved to electronic vouchers for nicotine replacement therapy and Champix. It's important to say we were moving to electronic vouchers from the 1st of April, which is fortuitous that was also happening at the same time. Smoking pregnancy and the children and young people service moved to telephone support and text support with direct supply of nicotine replacement therapy via post. I'm going to just focus today on the adult stop smoking service and what we did. If people want information about the other two, they can get in touch. So we got behind the campaign, as Greg said, because we wanted to seize the opportunity to support as many smokers as possible. And it was great to have the backing of the national campaign as well from Really 2025, Public Health England and ASH. So the initiative, as was heard, is there to educate smokers on the emerging evidence of increases to them and their family, and encourage smokers to take the important step of stopping smoking, which, as many have said, is always the best thing we can do for our health. So in terms of what we actually did, on the Smoke Free Sheffield website, we did a number of updates. One was, first of all, to have a Quit for COVID banner, and we also had a Quit for COVID button to make the information more visible on the site and very prominent. We created a Quit for COVID information page, and we also had a section on there for news updates, local and national, and blogs. We then updated information also on the support that was available for the stop smoking services, and developed a new page on COPD and COVID as well, and smoking. We're developing a nicotine replacement therapy page at the moment, and this is around thinking about population level quits for those people that won't come through the service, making sure they're equipped with the information on the options available to them. And we're developing a volunteers page so that people are equipped with the information of what advice to give to smokers when they're shopping for the shielded and vulnerable. And we're also developing an eight-minute video so that they've got the skills and training there. In terms of our communications, we informed all tobacco partners of the changes to the service website updates and the Quit for COVID campaign, and you can see the range of partners that we've got there that form Smoke Free Sheffield and our Tobacco Control Alliance. And that was really important across the sector, as it always is, in getting everyone behind the campaign, and we saw great support locally with that. We developed local Quit for COVID social media messaging, and this was developed both with our Sheffield Communication Service and Diva, who I commissioned to deliver Smoke Free Sheffield. They were done for Facebook and Twitter. All partners and communication leads were asked to tweet, share and like the Quit for COVID post from Smoke Free Sheffield and tag us into that, and also Sheffield City Council, so we could maximise our reach locally and nationally. And where appropriate, we also tagged in Breathe 2025, Fresh and Public Health England as well. We did further updates via the Sheffield GP Bulletin, Housing Staff Update and Sheffield Teaching Hospitals Staff Newsletter. I also developed a managers briefing now, which was circulated to all managers across Sheffield City Council, and this outlined the support that we wanted managers to get across to their staff. We updated the Sheffield City Council's COVID pages with Quit for COVID information, and we asked all partners to promote the council email. And we now have, as I'm sure many councils do, a COVID email that goes out every day with a variety of information, and it's been really fantastic because it's enabled us to get the Quit for COVID information out to a range of people in the community as well as staff. We then developed a Ramadan blog with a pledge to quit for Ramadan and circulated this to BAME and faith organisations, and we developed specific social media posts for Ramadan as well. Greg starred in a fantastic couple of Ramadan videos for us. The predominant message within that was around social distancing messages and hygiene messages, but we also managed to get in there some information around health and particularly Quit for COVID. We've developed a blog giving more detail about the approach that we've taken in Sheffield, and that's on the website. We've shared that on social media, and you can see there various people have shared it as well, which has been really helpful in getting that reach out. So on the 1st of April, to mark the launch of the campaign, from a regional perspective, we also shared this press release which we developed via the local press, but also the council newsroom, and the email that I've just mentioned. And the distribution of that email is just short of 68,000, which was fantastic. The press release was picked up by a local newspaper, the Sheffield Star, and it was shared on social media by them. We've developed a couple of stickers and leaflets. The leaflets have been distributed via our community workers who are shopping for those who are shielded and vulnerable. And from the 17th of April, the Quit for COVID stickers have been placed on food parcels that are being delivered for the council food effort locally. Around 30 parcels are being delivered daily, which to date is around 570 households that we've reached. Important because we know we wanted to make sure that we covered off every angle really in terms of reaching the most vulnerable and thinking about people who may not be on social media as well. So in terms of the web results, within the first just over a week, we had 976 visitors to the website, which was a 205% increase from the previous year. At the same time, we saw a spike on the 1st of April due to all of the comms that we were able to do, and 78% interestingly was from the Sheffield City Council email, showing the power of that email as well. And that was really instrumental in getting people to the Smoke Free Sheffield website for more information. So in total, for the whole of April, we've had just short of 1,900 people visit the site, which is a 138% increase on previous years. And social media and the council's email have been the main drivers of that traffic to the site. Again, 57% of people have viewed the Quit for COVID page, and we've had really high engagement of almost 3 minutes per average time spent on that page, which I'm told by my media experts is very high. Usually we'd expect around 1 minute before people switch off onto other things or look at other pages. or leave the site completely. So in terms of social media, we pay for some social media, and I think it's really important to stress that this is very cheap and a really easy, accessible thing to do. It only costs us £190, but you can do it for as little as £20. And this was a post on Twitter, and we reached over just under 43,000 people with that. And we did also develop some organic posts that went out every other day as well. So that was really helpful. We've had both positive and negative comments on our social media posts, ranging from people saying this is the best thing that they've done, even though it's been the hardest, to people saying this is not something that we should be doing at the moment and hijacking the situation. So we have had a range of those, and I think that there is probably a mix of that feeling for people out there. Overall results. So across social media, we've reached just short of 43,000 people, short of 68,000 from the council email update, and I can't see the figure. And there's the 570 households for food parcels. We've had just short of 1,300 engagements with the campaigns through likes and shares and comments and through click-throughs to the website. And we saw an increase in referrals for the Stop Smoking service by 53% in March. And this demand has continued, as Greg alluded to earlier, and the service have never been busier, which is fantastic. But what is a little bit concerning is we haven't seen that continued demand referrals from primary care, probably due to the range of different reasons. Smokers have told us, our advisors, that they are worried and want to quit because of COVID-19, and I think all of the above does demonstrate that they've been engaged and receptive to the campaign. So it's been fantastic to work as part of the partnership across both the region and nationally, and that's meant that we could really do more. The learning set's been really helpful in terms of resources and collaboration. Just for example, Freshly developed a radio ad which we're looking at adapting locally, and that's really helpful that some of that work has already been done and we can utilise that. So, and that's also saying we do need to look at licensing and things, and there was some cost to that, but it's really helpful that we can build on it. So this has already been mentioned already, that Maggie from the Sheffield Stop Smoking Service is supporting Louise Ross, who I'm sure many of you know nationally, with our Twitter clinic, which is not easy to say. And we've also, through texting our quitters, we've asked them if they would like to be part of promotion to communicate hope and inspire other smokers, and we had, just from one text, 10 people come forward, so we're progressing that. In terms of next steps for us, we want to build on what Hertfordshire did and text all our smokers on GP registers, and I've just had the go ahead this week to do that, so that should be happening very soon. We're developing a smoking and pregnancy leaflet for midwifery to support them, and we've also got a video that Greg's done for us, specifically highlighting the importance of quitting for COVID. And as I mentioned, we're looking at TV and radio adverts, and this will be through ITV On Demand and local radio. And there are opportunities there locally because of the lack of content. They're looking at offering fairly good deals as well, so that's quite helpful. Exploring options. At the moment, we're looking at funding e-cigarettes for very vulnerable groups, homeless, rough sleepers, substance misusers, and also people with serious mental illness as well. And we'll continue to do press releases to promote and normalise quitting as we go forward. Thank you very much.
Thanks, Sarah. That was great. And I would remind people from, as I said earlier, we are running another webinar next Thursday. We'll circulate the details of that, where you can hear from other authorities about the things that they're doing as well. So if I could ask all the speakers to be ready to answer questions. We've got quite a few questions through, so we'll just take 10 minutes to answer what we can, and those that we don't get to, we will respond after the webinar. So we had a question very early on, which I think was in response to your presentation, Deborah, so I'll come to you first, which is, given the higher motivation among smokers that we found in the YouGov survey, why do you think fewer people are accessing stop smoking services? So if I could ask you, Deborah, and then I might ask Sarah to also add her thoughts too.
Well, I think that actually, because there's not the face-to-face and because there's other things going on, people aren't necessarily aware, and that's where the campaigns like Sarah was talking about to make those links, and what Hertfordshire did with getting GPs to text smokers and ex-smokers are so crucial. And what I also wanted to say very quickly was that the webinar next Thursday, there may well be local authorities on here who've got great examples of what they're doing. Get in touch with the ASH team. Even if we have too many for the webinar, we're trying to develop case studies to share on the SFAC website, and your input will be really great. The more we can show all the different things that local authorities are doing, the better.
Yes, thanks, Deborah. Sarah, would you have anything to add to what Deborah said?
No, I just think it really is about letting people know that the service is still open for business through all the channels that are accessible to us.
Thanks, Sarah. Nick, we have quite a few questions from your presentation. I think there's a couple that are particularly linked to research coming from France, which I'm sure you're familiar with, where they're looking at whether nicotine can reduce the chances of contracting COVID. I'm being asked, is there a definitive answer on that question of whether nicotine can reduce the chances of contracting COVID? I'm going to go with the answer being no, but is there anything you want to add to that?
I mean, I think that, you know, the biology and the interaction of different signaling molecules and the way that the processes that regulate, you know, normal the normal functioning, you know, spiral out of control in people who are infected by COVID. I mean, it's enormously complex, and it's quite easy to pick up on a you know, a single correlation and say, well, you know, this provides evidence that nicotine is going to be protective. I mean, it just doesn't seem very likely that this is going to work. I mean, it's a testable hypothesis, and if people are doing a clinical trial and it turns out to have some protective effect, that would be both interesting and also very surprising. I think the key message at the moment is that there really is no evidence that smoking is in any sense, you know, a good thing to do in the time of COVID. It clearly is associated with worse outcomes, including increased risk of death. I mean, I suppose it underlines the fact that people smoke for the nicotine. So if you know, we need to make sure that people have actually got access to you know, pharmacotherapy, including nicotine replacement, in order to help them to get away from the hazardous thing, which is actually smoking.
Yeah. Deborah, sort of a follow on from that, really, people talking, several questions about, you know, locally. So I'll read this question out. We have some strong concerns raised locally that the evidence is not clear around the links between smoking and COVID, and people are saying that it's unethical to push this message at this moment. Is there, if there is something to the claims that smoking can be protective, have other areas experienced this, and how are they managing it? What would you say in response to that?
Well, what I would say is that actually, even those who think there may be a protective effect, and they're not talking about smoking itself being protective, the hypothesis is that nicotine might be, are not saying that we should not be discouraging or rather encouraging smokers to quit at the current time, because the overall health benefits of quitting, and in particular, the reduced likelihood that you'll need hospital or other NHS treatment, mean that it's still really important for people to quit. And one of the things we have done is made very clear that smokers should use the most effective methods to help them quit, and that includes using nicotine replacement therapy or e-cigarettes to help, and not trying to quit unaided.
Thanks, Deborah. Andy and Scott, we've got some questions about sort of different communications approaches, and whether there's any further advice around doing, for example, things on Facebook and making sure that Facebook will accept adverts that are put forward. Would either of you have advice? I'll probably come to you first, Andy. Any advice there, or places you can point people to?
Yeah, I mean, initially the toolkit did have a couple of ads that we've been running in the Northeast. So we ran them via Facebook mid-March, I think, in line with the first piece PR that we put out. So we did 2 prospecting ads, which are just Facebook ads served to kind of to everybody, obviously targeting by demographics. It did take longer for the approval process. There were very straight factual ads around smoking, increasing the risk from coronavirus and quit and reduce coronavirus risk. Very factual. We also put in a video of Dr. Ruth Sharrock, a respiratory consultant from the northeast, which we promoted as well. And I guess we sort of waited with bated breath to see whether Facebook would approve these ads, because I mean Facebook can be quite rigorous in terms of health messages. It took a bit longer than usual, but they were approved. We're running another tranche of digital advertising on Facebook as of Monday this week. We've slightly kind of honed and tweaked the messages. We're also running we're running 2 radio ads in the northeast, which kind of work as a pair. So one is around COVID, but there's another one around what happens when you quit. It's based on the excellent Public Health England animation showing how your body repairs itself. So we're kind of doing that harm and hope approach. So I think we can very definitely share at least sort of share for partners that, in the greater good, the wording that we're using, because I mean it's out there in the public domain anyway, that has been approved on Facebook. So we obviously have some learnings in terms of how smokers are kind of responding to the adverts, but I think it's, of course, you are getting some of that pushback that you will often get with health messages. But what's really clear is we're getting an incredible rate of click-throughs to the National NHS Smoke-Free website. We're getting a rate of engagements and likes and shares that I've rarely seen. I think the last time I checked, the video of Dr. Ruth Sharrock was up to about 170,000 views. That's probably about a week ago. So I think it just ties in with the YouGov figures, just about the real, the massive receptiveness out there to messages. But yeah, happy to share those.
Thanks, Andy. I think that it sounds like it would be useful to people. We don't really have too much more time, and there are still quite a few questions. So certainly, if there are things that occur to you, then drop them in, and we will respond. Deborah, I want to come back to you again. We've a question here about: is there any scope to access funding or support from the government or other sources to really push the Quit for COVID message? Since this media on television, since this medium has been lacking due to funding reductions in recent years. If you have any response to that.
Well, it's difficult. I mean, we have actually been encouraged to put in a bid for some of the government funding for charities, which help boost the Quit for COVID campaign, but basically TV advertising is more something for Public Health England, and maybe they should be asked, given the cheapness of TV at the moment, whether there's anything more they can do. I think the problem is that obviously Public Health England is very busy with the overall COVID issue and may not have capacity to think about this, but I would hope that I do think that what we're doing is brilliant, but it's very limited resources, which is why it relies so much on local authorities doing it for themselves, and we'll do what we can to support. But this has been done on a shoestring with an enormous amount of goodwill from Breathe 2025, from Fresh, from Greater Manchester, from all the partners we're working with. So yes, if there was funding, we could do it better, certainly. But I think local authorities can still do a brilliant job, even if there isn't funding.
Yes, I think that's absolutely right. And I think, from what we've heard from Sheffield and from the examples that we have had through that we'll also present on the webinar next week, we can certainly see that people are seizing the moment. Sorry if we haven't managed to answer your question. Particularly, several of you have raised questions which I think are for Public Health England, and we will take those and feed those back to Public Health England, and we'll respond to your other questions as well. We'll circulate the very. Sorry, Deborah, did you want to come in?
Yeah, just before you wind up, could I just go back to that point about whether it's ethical to encourage people to quit.
Yeah.
I think if one looks at the balance of risk and benefit, it is always better for smokers to quit. And the argument is about whether smokers are more or less likely to get COVID. But what we can see is that smokers who are admitted to hospital with COVID, which are the ones who are at most risk, have much poorer outcomes than non-smokers. So I think in terms of the ethics, the answer is very clear. It is still better to quit. Nick, I don't
and Greg wanted to add to that, I think, Greg.
Yeah, just I mean, yeah, it's been broadly said, but inaction also has consequences, and that has ethical implications too. And I agree with Deborah. It's about the balance of risks and benefits, and the weight of evidence is leaning very, very definitely in the quitting is always a good thing. Quitting in these circumstances is almost certainly a good thing. The science is changing pretty quickly. We change our response, but where I am today on the evidence is that quitting is a good thing. The end.
Well, I think that's a perfect note to end on, and look out for the emails that follow up this webinar, and we'll certainly hope to welcome many of you back next Thursday for a follow up to this webinar, and thanks to all the speakers for their excellent presentations.
Cool. Pleasure.
Thank you all.
Thank you.
Thank you.